because there are
Yeah.
some exercises that you wouldn't want to do to the nerve when there's an axonal injury because it could further kind of irritate
Mm.
it.
Most people think pain works like a warning light. Fix the problem and it goes away. But what happens when the light turns off and then comes back on again? In this episode, I sit down with the Optimal Health Guide, Josh Vance, to unpack why recurring pain is so common and why many people never get clear answers about it. We explore the difference between symptom relief and real healing, the everyday habits that quietly bring pain back, and the diagnostic process that helps uncover what's really going on inside of the body. You'll also hear why recovery is rarely a one-time fix and how the right partnership with a healthcare provider can help you move beyond temporary relief toward lasting health. If pain has ever returned after you thought it was gone, this episode will help you understand why. Pain isn't just about one joint, one injury, or one bad day. It's your body asking for attention, and the right guidance can change everything. Welcome to the Optimal Health Guide. I am your host, Michael, and we're here with the Optimal Health Guide, Josh Vance. Hey, Josh, good to have you here on this call.
It's great to be here.
Hey, Josh, we are at a fun turning point. I remember when I first pitched this idea to your wife, and this idea was coming to fruition, and said, "Hey, let's have one episode or one season that we launch and have it all released on one day." At the time of this recording, that day is tomorrow, so everybody's going to have access to season number 1, and we're recording season number 2, and now people are going to get to experience a weekly production of this. Tell me some of your thoughts now that this is technically our 7th episode recorded, the beginning of season 2. Do you have any thoughts or reflections about the journey so far?
Well, I think it's been fun to engage in conversation about pain and different problems that people might have and how we can help them and just in a lot of different ways that they can get help. And, when things aren't going well, what might be causing that, talking about different things that we can utilize to help really come to the underlying cause of the pain and the root of the pain. So that's just been really helpful, hopefully for the audience, but it's been fun for me because we can really just share some of those things that we can help people with. And that's why we're here to help people.
I find that I'll be in conversations, completely different setting, and I'll be like, I actually heard something about this. Did you know that there's such thing as referred pain? And so I'm learning a whole bunch as we go along, and then I'm sharing that in other circles as well. The EMG test too. Like, did you know? And of course, I'm not using the exact language you use, but drilling down into, you can actually find out what's going on at the nerve level. So it's been fun. I've been learning a whole bunch along the way. One other thing before we jump into the content for today is we had the relatively unique opportunity to be together, and I got a chance to tour the facility. I got to see the new signs that are out there that are beautifully lit up at nighttime, but also during the day, just looking really great. And then I got to tour the facility. Tell us a little bit about the remodel that's happening and some of the changes that you're bringing about there at the office.
Yeah, so we've been remodeling here for a little bit, and it started out with some new signage in the front that just kind of snowballed, and
Yeah, as
the
it does.
building's a little bit dated, in great shape, but just dated. So we needed to update a little bit. So we've been working with some friends and different people that have been able to change the lighting, make it a little bit brighter. Actually, it's a whole lot brighter in
That's
the
great.
front waiting room. Put in some LEDs, some paint, some new cabinetry, some new countertops, a lot of paint, kind of redoing treatment rooms as we get there. We aren't quite there yet, but just really updating it, making it. In fact, we've been able to redo the bathrooms too. So not quite done on the flooring, but just a lot of things to make it nicer, more updated, brighter,
Yes.
and just hopefully just a better experience for people as they come in and work with us.
Yeah, it looked so great. I loved, there was one spot where you showed us the countertops that were there and the way that played with the color scheme. That's going to be so great. By the time that spread all throughout, it looked really, really good. And then the other thing I really remember is, like, here's a new, office space or a space, and then here's the old one. And you can totally see the dated look in there and the fresh upgrade that's going to bring to the table. So I'm looking forward to that coming to completion and the benefit that's going to bring to everybody that walks through those doors. So Well, Josh, what I'm hoping today in this conversation that we can do is that we could really help listeners understand why pain often returns and why short term fixes rarely solve the problem. In a way, you could say that if you look back at season one, we've laid some foundation for some of those things, but I'm hoping to potentially dive even deeper into it. And so let's see where we can go from there. So my first question I'd love to have you address, why is it that so many people experience pain relief for a while only to have that same issue return months later?
Well, the easy answer is that the issue wasn't fully handled. Now, what I mean by that is there's actually several different possibilities, but that's kind of the easy one. If it wasn't fully figured out, then the pain's going to come back. But there are other options, other possibilities. One might be maybe a patient completed therapy, but they didn't know what they were supposed to do after they completed the therapy. Well, in that case, that's not good for the therapist. That should have taught them, the different things that they need to do to maintain that improved condition. Another option would be maybe they did something. They decided to go this morning, had somebody that was helping family move furniture. So maybe they went and moved furniture, and then that kind of exacerbated some of those problems that they've been dealing with. Another issue, it could be that it's a chronic condition. So one that may not ever completely resolve and can have periods of exacerbation relief. A couple examples of that might be like TMJ, temporal mandibular joint dysfunction. It is a chronic thing. There's dysfunction in that joint. It's never going to be absolutely 100% pain-free, but yet we can control the symptoms. We can keep them under control. Another could be somebody with a pinched nerve in their back, and maybe they're appropriate for surgery, but they just don't want to have surgery for whatever reason. The probability of them having absolute 100% relief if they're needing some surgery, it may not be there, and they may be dealing with it back and forth a little bit. So they could have some periods where it gets flares up and other periods where it kind of calms down. So that could be another possibility.
Yeah. So it sounds like there might be a chance that somebody, like you had said, in kind of what I describe as like the maintenance side of things, you've gotten the help, but like I haven't been able to maintain it on the other end. Or like you're saying, I've received help or the pain is gone and yet it's come back because I did something more extreme, like you had said, moving. That reminds me of a story of my wife where we were moving some canning jars. She was so excited to get access to these new canning jars, and she picked up and twisted, and it really put her down for quite a while because of the weight of the box and the movement that she was making. Or you're talking about the idea that it could be a chronic situation. So with those three ideas there, is it fair to say that really it's like a discovery process? So again, whether I cross the threshold to come to meet with you or not, I may figure out something on my own. Like you've said, just bear the pain and continue on, or somehow it just eventually goes away. By the time I do cross the threshold to come meet with you, though, even though you have access to hands-on technology and, that can guide you to be able to see, under the surface, it still is a bit of a journey that you're walking on, discovering along the way. Is that a fair way to phrase it, or how would you put that?
Yeah, I mean, it's always a journey in the sense of it's a process. Maybe that's a word I might use, but a process of determining, what are these factors? What kind of a pain is it? How long have we had that pain? And then coming to understanding what is the cause and the root of the pain, whether or not we need to use some specific testing or not. And then learning how to do these things which are going to help me get out of pain, and ultimately learning how to do these things to maintain at least an improved condition in a situation with somebody that might have that chronic back pain that really could benefit from surgery, or in maybe some of these other situations where it is complete relief, reasonable possibility that they not only understand how to maintain their improved condition, but they know how to handle it if they do something and they move the couch and they exacerbate it. What are those things to do to kind of get it back under control? So yeah, it's a process. We're a journey.
Yeah. Well, and again, I'm going to layer in the partnership language that we oftentimes use. You're a guide, you're helping people along this process, along this journey. And sure, it would be nice to maybe meet you one time, have you help once, but usually because of life and circumstances, the likelihood is that I need somebody like you in my corner to call upon when something does take place there. So I really do see the benefit of the relational component. You're not just a service provider, it really is a relationship. I'm thinking a lot of the familial language that you've used to describe how you care for people. You're not just there once in somebody's life, you're likely going to be touching lives in multiple times. So, any thoughts on that? Just that longer journey of being with people?
Yeah, I mean, you're right. We frequently do see somebody for a case. Maybe they come in because they had a shoulder issue and they had shoulder surgery. And so we're helping them through that period of time. But then in the course of life, a lot of other things happen. We get in car accidents. And so then we need some help with a car accident, or their kiddo is playing soccer and injures their knee, and so we're working and helping the family with it, with their youngster, their teenager, or maybe their grandpa had a stroke, and now we're helping them get back to being able to stand up, being able to walk, get in and out of the car, do those normal daily activities. So it is a journey, and we do see people and families, and that's one of the things that I have found most gratifying is just being
That's great.
able to spend time getting to know families and seeing, and then I'm out in the community at the park or at the grocery store. Hey, how you doing? For me, that's pretty good, pretty cool.
Yeah, I remember seeing you greet people as they were walking by, getting ready to meet with someone there, and you can just tell the relationship that's there. In fact, I was on my way out. I'd already said goodbye to you, and a treatment room door was open, and I noticed, oh, I know that person. I said hello, and they're just surprised to see me there, and you could tell the trust that this person had with you. Like, yep, I'm here. Josh is taking good care of me. And so, again, I think all of that just points back to the kind of care that people are receiving there. Well, let's dig into the second question. Again, we've laid some of these things on the table already in our previous conversations, but you've got symptoms of pain that somebody may be experiencing, and oftentimes you're just looking for relief of those symptoms. But you're always wanting to, like, we got to dig beyond those symptoms and get to the root cause of the pain. And you've got available from your training and education and the resources you have means to be able to dig into that. So why don't you just start at a broad level? What's the difference between treating symptoms and addressing the root cause? And let's see if we can't go a little deeper into that.
Okay. Well, treating the symptoms in some simple cases, that might absolutely totally solve the problem. And that's easy slam dunk case as I usually consider it. And that's fantastic because, for a person with the pain, you know, just those simple symptoms, simple solutions, quick progress, I'm back to doing what I want. And that's fantastic. But other times, those simple same symptoms may not be quite so easily resolved. So it's kind of like this. Okay. So I'm here. I hurt maybe here in the shoulder. Okay. And I've got some pain right over on the side of the shoulder here. It's been there for a while. And we might do some stretching. We might do some soft tissue work, maybe some strengthening exercises. And we might keep doing this for 3, 4 weeks. Okay. Might feel good for a period of time, and it might even help a little bit, but maybe it hasn't made a huge difference. Okay, so then the question is, why has it not made a big difference? What is it that's going on that is causing this to not get resolved quicker?
Hmm.
So in this situation, we're treating the same problem, shoulder pain. It's been there for a little bit, but let's look at how we might now see about getting to the underlying cause. And this kind of comes up because I had a patient recently with these symptoms, and I think it's just a beautiful picture in how to come to understanding the root cause versus just treating the symptoms.
Yeah.
Okay. So what I would say is in the same situation with the weakness, we could maybe do a diagnostic ultrasound. Okay.
Hmm.
And so we then look at that. We can see the ligaments. Well, they're normal. We look at the bursa and the shoulder, all sorts of different structures, and the bursa is normal, and the the rotator cuff tendons are normal and the biceps tendons normal. There's no swelling present. So, we can determine that this is a normal shoulder in
Yeah.
structure, and there's no structural issue causing this shoulder pain that we've got. Okay, that's great. But what else could be causing it? Maybe there's something else. Okay, so in this situation, a nerve test would be appropriate too.
Hmm.
And so we could do a nerve test, and lo and behold, we find out that there's an acute injury involving the C5 nerve root, which
Hmm.
refers pain over here. Okay.
Yeah. Yeah.
And it's pinched. And so we now know that the cause of these symptoms is actually from the nerve root in the neck. Okay, so now we can really dig into that and
Yeah.
we can start doing that treatment, not just for the symptoms, but really at that nerve that needs that help. We can do some traction,
Hmm.
some exercises, some stretches for the muscles that are all guarding and tight, some soft tissue work to get the muscles to relax. We can even do some nerve exercises. And then over time, these symptoms begin to abate. They slowly improve. And we still want to do some shoulder strengthening for that weakness, but the pain begins to abate. We start to see some fewer symptoms, less frequent pain.
Yeah.
Maybe that numbness and tingling they had, that's also better too.
I
The
love it.
strength is improving. Yeah.
That's great. What it's given me the picture of is, even while we were designing this podcast in concept, we were looking for a name and we knew optimal health was key language, but then we placed guide next to it to highlight you. But I love the way that even in what you just described, in what you described, we could have named this podcast the Pain Relief Guide, but that it's so much more than just that. People, though they may come to you with the initial impulse to seek relief from the pain that they have, you have such a longer term trajectory to get to this root cause and to be able to help them to, walk in that optimal life. Even with the person, you're describing, I'm imagining there were things they couldn't do before. And then with the insight that you brought to the table, the coaching along the way, they're able to do things that they wanted to do on the other side, which is so much a picture of stepping into and experiencing the optimal health that you dream of for people. Any other thoughts on that topic of symptoms and root causes and some of the layering that I'm bringing in there with the optimal health versus just pain relief?
Just that, when we're looking for ideal health, there's a lot of different components to it. Yes, the pain is important, but also there's function. Are we able to actually do everything that we want to do, or are we kind of holding back because of fear or inability to actually maybe able to do something? So that all, contributes to that ideal, optimal wellness and health too.
Yeah. That's great. Well, hey, the last question that I'd like to get into with this conversation would be, in some ways, you used a little bit of this with this example that you brought up. But how do you advanced diagnostics help break that cycle of recurring pain that somebody may be having? And maybe you could even, like what you've done so well in this call, point us to a situation where you've experienced that with a client.
Okay. Sometimes when a person comes in and they're describing their symptoms and how long they've been having it, and we're getting their history, it can get a little confusing. Sometimes there's a lot of other information that people bring in that may not be necessarily as important
Yeah.
as relevant to what they're speaking about, but they may not know. So the symptoms could be a little bit vague, unclear, sometimes very diffuse and not real specific. So one of the things that I'm always trying to do is differentiate, well, what are the possible causes of these symptoms that they're talking about? A differential in my mind of possibilities. And then as we're going through the testing, we're trying to kind of throw out things. Well, this probably isn't it. This probably isn't it. Well, this
Yeah.
is highly likely. Okay. Well, that's also where the diagnostic testing can come in because, in fact, recently I had a athlete essentially, and they performed, but yet their shoulder was having significant problem, and they weren't quite sure what was going on. They'd had this on and off for a while, and they really do some amazing things in their sport. And so, it was important to actually identify in the shoulder, well, what's going on? Is this Is this just weakness? Is this an issue where we have some structural injury in there? Is this something else? So in that situation, the ability to clarify, all
Yeah.
right, and not guess what could be causing the pain, because there's kind of several different things that can happen. You can guess about a problem in this situation that's not real clear, and you might get lucky. You might get it totally solved, or maybe just some improvement. Okay, and then on the other hand, you might get unlucky in that
Yeah.
shotgun approach really didn't make a lot of difference to the treatment. Okay, so for the ideal outcome, we want to know exactly what the problem is. So
Yeah.
that's where maybe in this situation, using that ultrasound to actually evaluate their shoulder and look at the rotator cuff and all the different structures in there. And then we can confidently, absolutely say, okay, well, this is a absolutely normal scan and there's no tear, there's no swelling. Now we can treat this aggressively to get that strength, to get that function, so that now you can go back to the sport and do what you need to do. And then understanding also a proper warm up and other components before they go and perform so that they're actually handling it. Okay. Versus maybe another situation where they're having that shoulder pain. We look, we see, oh, there's a partial tear of one of your rotator cuff tendons. Okay, we can treat that. Or on the other hand, they have like a complete tear. Well, that's not
Hmm.
going to be good to treat. We need to get them over to the surgeon so that the surgeon
I
can
see.
help them,
Yeah.
because it's never going to get better unless they get surgery if it's that substantial.
Yeah. Okay. Yeah. So I'm picturing, a high school student athlete based on the scenario you're bringing. I remember being a high school athlete and wanting to get back out there to play if I had an injury. So I can see the ways that you're utilizing these advanced diagnostics to be able to help them identify what the problem is. And I like the way that now we can go at this more aggressively because we understand with clarity what we're actually dealing with. And I could almost feel that breath of relief, like, yes, okay, I can do this, this, and this. You're empowering me to be able to get back to where I want to be. And then even with the other alternative that you laid out there, let's say that we do run the advanced diagnostics and you discover the full tear, though that may not be the news that I had wanted to hear, it is still helpful and clarifying because it allows me to know the route that I need to take to be able to get where I want to go the quickest. So again, just a great example of the support that clarity brings to be able to know which route to be able to take. Any other closing thoughts on that before we wrap up today's call?
Okay, so I'm going to go back a little bit in regards to nerve testing and EMGs. So there's also situations where that's particularly helpful to do a nerve test or an EMG, because it brings clarity to
Hmm.
the nerve. Okay. And what I mean by that is that actually helps to identify the anatomical part of the nerve. And when you look at the anatomy, the outer part of the nerve is the myelin sheath. And that's like, if you're looking at electrical wires, that's like the conductive part. Okay. So that
Okay.
makes that
Yeah.
impulse conduct rapidly. And then the axons are the inner part. All right. So when we have injury to the myelin or the axons, that's going to affect the outcome. It's also going to tell us about the prognosis, because an injury to the axons, they're going to take a lot longer to heal than an injury to the myelin sheath. So
Okay.
understanding what kind of an injury we have when we're looking at a person that maybe had a pinched nerve and maybe they can't lift their arm or pick up their foot, having that clarity can help provide some information as to prognosis in the situation where, okay, now we know that this is not an injury to the axons and it's a conduction block or a myelin injury, versus this is an injury to the axons. And we
Hmm.
know that this is going to take longer, but it also affects kind of treatment in the way of exercises that we want to do. Because there are
Yeah.
some exercises that you wouldn't want to do to the nerve when there's an axonal injury, because it could further kind of irritate
Mm.
it,
Okay.
versus a myelin injury. Okay, now it's appropriate to do this. So in that situation, breaking the recurring pain, that certainty of what that problem is actually, and then that leading to the correct treatment has to be implemented. And that's one of the benefits of using diagnostic testing.
That's so great. Well, I'm hoping that listeners are seeing the good hands that they would be in if they came to advanced physical therapy. Well, if anything that we've talked about today sounds familiar or even something that might be hopeful for you, one of the best first steps is simply just getting some clarity about what's going on in your body. And so Advanced Physical Therapy and Wellness, we offer free consultations so that people can start asking those questions and understanding their options before committing to anything. And so we'll provide links for you to be able to jump into action if that's something that you're interested at looking at. Thanks everybody for listening in today's call. We look forward to the next conversation.